Published by WordPress.com. Gunshot injuries in general trauma. Ballistics. 1. Low-velocity firearms. Velocity, less than 2,000 feet, sec. Includes handguns. Wound classification, similar to Gustillo-Anderson Type 1 or 2. 2. High-velocity firearms. Velocity, greater than 2,000 feet, sec. Includes military and hunting rifles. Wound classification, similar to Gustillo-Anderson Type 3. And 3. Shotgun wounding potential. Dependent on choke, shot pattern, load, size of the individual pellet, distance from the target. Energy transfer. The energy delivered by a missile to tissue depends on 1. Striking energy, energy on impact. 2. Exit energy, energy remaining after exiting tissue. And 3. Missile behavior, tumbling, deformation, or fragmentation. Tissue parameters. Permanent cavity, formed by the direct passage of the missile, proportional to the projectile size. Temporary cavity, results from lateral displacement of tissues, leading to larger soft tissue damage. Shock wave, displacement of incompressible liquids in tissues, causing significant damage distant from the missile's immediate path. Clinical evaluation. Polytrauma assessment includes neurovascular, NV, evaluation. Skin wounds, inlet wound, small, regular edges, inverted, with burning or abrasions. Exit wound, large, irregular edges, everted, with more bleeding. Imaging. X-ray identifies retained missile fragments and associated fractures. CT scan, useful for intra-articular or complex injuries. Treatment. 1. Low-velocity injuries. Managed as open fractures, Gustillo Type 1 or 2. 2. High-velocity injuries. Managed as open fractures, Gustillo Type 3. And 3. Indications for surgical debridement. Retained bullet fragments in joint space, subarachnoid space, vascular disruption, palpable missile on palm, sole, gross or gastrointestinal contamination. Special considerations. 1. Abdomen. Gunshot wounds involving bowel contamination require debridement of intra and extra-abdominal paths. Broad-spectrum antibiotics covering gram-negative and anaerobic pathogens. 2. Spine. Surgical decompression and removal of bullet fragments indicated for neurologic deficit correlating with radiographic compression. Retained fragments in patients with incomplete motor deficits. Complications. 1. Retained missile fragments. Foreign bodies leading to chronic infection or inflammation. Lead intoxication, plumbism. Common with retained fragments in joints or subarachnoid space. Symptoms: neurotoxicity, anemia, emesis, abdominal colic. 2. Neurovascular damage. Requires careful assessment and potential intervention.